When I worked on a pediatric flight team, I'd be up in the sky, and in front of me, there'd be someone's child on a stretcher. Up there with rivers braiding and highways stretching below, I'd be thinking about the parents of this child. I'd reflect on all the grief, worry, and fear that I saw on their faces. I'd think about if anyone had talked to them about these things. I'd wonder if back at the hospital, if anyone had explored these things. I'd wonder, had anyone talked to them about their child's prognosis? My experience working on a pediatric flight team showed me that there were elements of our healthcare system that didn't sit well with me. I could see that we had the smartest professionals and some of the best technology, but somehow suffering seemed to ooze from the seams. From my position, it seemed like sometimes the care that people got didn't make their lives better, and sometimes it seemed to make it worse. It also felt to me like the hospital I worked for ran on the revenue of suffering humans. These experiences and thoughts had a profound impact on me in my next steps in life. I wanted to address the suffering. I wanted to do something about it. I decided that instead of staying in the exciting environment of helicopter emergency care, that I would become a palliative care nurse. I don't know about other little kids, but I didn't dream of this. I traded what many folks would consider to be a hero's job to help people in this setting. And I think many people around me, my coworkers included, thought this was strange and probably uncool. As I gained experience working in palliative care, I watched my coworkers, the other nurses, doctors, aides, and social workers lead their patients towards well-being in the face of serious illness. They did this across the lifespan, from 2-year-olds to 102-year-olds. To me, it almost seemed like a parallel universe existed in our healthcare system that harnessed all the same smart people and all the great technology, but they did it with a different medical framework. I came to understand that medical framework as palliative care. Palliative care is about reducing suffering and improving quality of life through specific knowledge and skills. Like other medical disciplines, palliative care professionals have a primary procedure. And for us, that is the family meeting. Inside the family meeting, hopes, fears, grief, and goals are all explored. And the skill set that we use in the family meeting is the skill of effective communication. I want to show you how this looks and feels, but through a story of a person, and that person is Dale. Our team got word that Dale was changing. Dale was starting to fall, and his condition was clearly worsening. His family, his friends, and most importantly, the caregivers at the nursing home thought that Dale needed something else, something more. The management at the nursing home put it to Dale bluntly. They said, "Dale, we're worried about you. Things are changing and we're short-staffed. We think you need something else, something we're not providing. You need to find a new place to live. We want you to find a new place to live." For Dale, this was really serious news. I found this out because I spent hours with Dale in the family meeting, where we explored his hopes, fears, and grief. Dale told me that while living in a nursing home wasn't what he had pictured for himself, Dale had been an avid skier. Dale had traveled the world. But for Dale, this nursing home was home. He found meaning there. Dale also addressed his changing condition. Dale could see that his ankles were swelling. He knew that. Dale knew that he no longer could walk independently and that he was spending his days napping more. My family meeting with Dale reminds me of a quote by Václav Havel, who said that hope is not the conviction that something turned out well, but the certainty that something makes sense regardless of how it turns out. For Dale and all the people around him, the family meeting helped him understand what his hopes were. And for Dale, he found meaning and hope in this nursing home. For Dale, he still could visit with friends on the back porch of the nursing home. Dale could still sip wine and watch Mariners baseball on the TV. Dale found meaning here. And Dale knew where he wanted to put his energy, which was right here. It wasn't somewhere else, some other nursing home. And it certainly wasn't medical appointments to find out why his ankles were swelling and to fix it. Dale had meaning in this place. And everyone around him heard it. And the palliative care skill set in the family meeting helped him do this. Dale was helped. Dale was helped because our team is funded through grants. But sadly, millions of Americans are not helped through their serious illness because palliative care largely goes not reimbursed by medical insurance. Medicare covers hospice when someone has 6 months or less to live. But palliative care is not hospice, and Dale didn't need hospice. Medicare will also pay for curative therapy. But palliative care is not curative therapy, and Dale didn't want curative therapy. In the eyes of insurance providers, it's almost as if there are two options: die or get better. But being a human, it's not like being a light switch. We have complicated and nuanced hopes, goals, and fears. Thankfully, there's things that we can do. We can do something about this. We all deserve this kind of care. We all deserve goals of care conversations and healthcare professionals that can help us explore our fears and hopes. So the first thing we can do is that healthcare professionals working with people with serious illness, and frankly, that's all of us, can learn the skills of palliative care. We all should be able to walk our patients through goals of care conversations, face their fears, and address their hopes. Second, schools educating the future generation of healthcare professionals should embed their students with palliative care teams. Allow these students to see the tremendous impact that palliative care has on patients' lives. Third, and most importantly, let's incentivize this important work. Let's pay for the family meeting. Let's pay for the skill set of palliative care and effective communication. It has tremendous impact on people's lives. Reflecting on my journey makes me realize that our healthcare system needs to make the same one. Palliative care, in its aim to improve quality of life and reduce suffering, is the kind of care that we need. With it, we will move to a healthcare system that runs on the revenue of human well-being. Thank you.